Welcome to The Data Pulse, a data-driven health podcast breaking down key health trends and insights in South Carolina. Brought to you by the South Carolina Department of Public Health. Visit dph.sc.gov/tracking. Better info, better health. Here's your host, Tony G.
Welcome inside the Data Pulse. I am your partner in praise, Tony G. SC Tracking strives to provide a network of integrated health and environmental data to reduce the burden of environmental health-related conditions for South Carolinians. SC Tracking offers a portal to health and environmental data, making it easier to access, track, and study potential relationships between South Carolina's environment and health. Did you realize that maternal mortality remains a global challenge? About 287,000 women died from pregnancy or childbirth-related cases in 2020. With the vast majority occurring in low to middle income countries. Most maternal deaths are preventable with access to proper care before, during, and after childbirth. Today we talk with Carlos Avalos from the Bureau of Maternal and Child Health Division of Population Health Surveillance. Today we talk about the SCBRFSS. What is that? We'll find out after this.
Are you looking for accurate data for school projects, grant applications, or business presentations? SC Tracking has that. Go to dph.sc.gov/SC Tracks. SC Tracking tracks state and county level data. It's easy to get started. Visit dph.sc.gov/SC Tracks. Better info, better health. Brought to you by the South Carolina Department of Public Health. It seems like data is everywhere these days, but is it reliable? Data from SC Tracking is both accurate and reliable. It's easy to find, easy to use, and has a guide to help you find the information you need. Visit dph.sc.gov/SC Tracks. Do you want to compare health conditions in your county to the rest of your state? SC Tracking tracks that. Maybe you're concerned about air quality where you live. SC Tracking tracks that. Or maybe you're interested in rates of different types of cancer in your county. SC Tracking tracks that too. Visit the SC Tracking website at dph.sc.gov/SC Tracks and try it out. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Welcome back. Today we share some time with Carlos Avalos from the Bureau of Maternal and Child Health Division of Population Health Surveillance. We've got a program that he's over. The history of it we'll talk about and more. First of all, let's introduce him, who he is, and how he got into this particular area of expertise. Good morning, man.
Yeah, absolutely. So I grew up in South Florida. I went to the University of Central Florida for my undergrad in biomedical sciences, and I've always been interested in public health and individual health. So when I moved to Columbia, South Carolina, I started the master's program in epidemiology. So I wanted to, I've always been really interested in computers as well. So epidemiology sort of combined both of those worlds. So an epidemiologist is basically just a data scientist that's working primarily on public health data, as opposed to other data scientists that might be working on financial health data sets or insurance data sets and things like that. So this really combined both of those worlds for me, and enjoyed it ever since. So I graduated with my master's in epidemiology in 2019, and I'm finishing up my PhD in also in epidemiology this year. So I'm really excited about that.
Gotcha. So today we're talking about South Carolina BRFSS. What does that stand for, and how did it come about?
Yeah, so the BRFSS is the South Carolina Behavioral Risk Factor Surveillance System. It's a large public health telephone survey that we conduct at the Department of Public Health. We conducted with the CDC. So it's a federally funded program that we conduct in the state. It's partially funded by the federal government. It's the largest and longest running public health survey in the world, actually. So it's been going on since the 1980s. It's now going on in every single state in the United States, as well as several territories and areas outside the continental United States. And I think altogether we conduct almost 500,000 telephone interviews on a yearly basis. So in South Carolina, we've been striving, the minimum is 4,000 interviews so that we can have enough sample size to conduct analyses at a smaller level, like zip codes and counties. But we've been striving towards more than doubling the sample on a yearly basis. So we've been collecting around 10,000 observations every year here in South Carolina, and it's all telephone based. So it's about a 25 to 30 minute interview that we conduct over the phone. So it's either a landline. Most of our interviews happen over cell phone. So about 75% are cell phone, and about 25% are conducted via landline. But that percentage is sort of decreasing, right? So we're moving more towards a higher percentage of cell phone completes, mainly to be representative of the actual population. So only a very small percentage of people, of adults here in South Carolina, have only a landline telephone in their household. Most have at least a cell phone, if not both a cell phone and a landline, as you can imagine. And it is random digit dialing. So that's the sampling frame is, we basically divide the state into the regions, and we conduct a randomized sample survey, so random digit dialing survey in each of those, so that we can at least represent every area in our state. So instead of just, as you can imagine, if we just random digit dial the entire state, then the majority of our sample would be Charleston, Columbia, Greenville. So we want to divide the state up and conduct the same survey several times in those smaller areas, so that we can collect and be representative of the entire population, not just the large metropolitan areas. So it's considered a stratified, randomized survey.
Let's take a break here. We'll come back and talk about what kind of data is actually taken in these calls and how that affects you as a South Carolinian, or what you can get out of it, as a matter of fact. We'll talk about that when we come back.
It seems like data is everywhere these days, but is it reliable? Data from SC Tracking is both accurate and reliable. It's easy to find, easy to use, and has a guide to help you find the information you need. Visit dph.sc.gov/SC Tracks. Do you want to compare health conditions in your county to the rest of your state? SC Tracking tracks that. Maybe you're concerned about air quality where you live. SC Tracking tracks that. Or maybe you're interested in rates of different types of cancer in your county. SC Tracking tracks that too. Visit the SC Tracking website at dph.sc.gov/SC Tracks and try it out. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Welcome back to the Data Pulse. We started the program off talking about maternal mortality, and it remains a global challenge. Having a skilled birth attendant, meaning a doctor, nurse, or midwife, present during delivery significantly reduces the risk of complications for both the mother and child. However, in many rural or underserved areas, women lack access to qualified health professionals during childbirth. Today, we're talking with Carlos Avalos, the Bureau of Maternal and Child Health Division of Population Health Surveillance, about the SCBRFSS. We've been talking about the data that it actually collects and how is it usable for the average South Carolinian.
So BRFSS collects information on behaviors, for example, health risks like smoking, drinking, health benefits such as nutrition information. We collect information on physical activity, for example. We collect information on other non-medical factors like having access to health insurance, having access to a doctor, seeing a doctor in the previous year, information on immunization status. So, we ask individuals if they've received their annual flu shots, if they've received their annual pneumonia or their pneumonia shots if they're in the age range. That needs to take those. Over the past couple of years, we did also include questions about receiving the COVID vaccine so that we can get an idea of maybe areas in the state that are under utilizing resources like that. We also, we also collect information on emerging topics sometimes. So as you can imagine, this is not something that, this being such a large program, such a large survey, is not something that only one person, for example, like myself, can decide what is going to be included in the survey from year to year. It's not, it's not my survey. It's not our agency survey. It's the survey for the people of South Carolina. So we work a lot with external partners and internal partners as well. So other stakeholders like smaller nonprofits like Children's Trust or of South Carolina. I don't know if you guys are familiar with that. And we also work with internal partners like our divisions of chronic health, our divisions of tobacco, cancer, for example, to decide, what emerging topics are coming up in those areas that we need to be on top of, because the BRFSS is really the most upstream sort of data set collecting information, so that we really want to be ahead of any sort of emerging public health topics, so that we can collect that information and by the next year have actionable data that we can utilize to make changes.
Don't forget, you can find all this information and more at SC Tracking. Listen, we've got more information still to come. Of course, there are partners involved in this. We'll talk about those partners and how this information helps them after this.
Are you looking for accurate data for school projects, grant applications, or business presentations? SC Tracking has that. Go to dph.sc.gov/SC Tracks. SC Tracking tracks state and county level data. It's easy to get started. Visit dph.sc.gov/SC Tracks. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Welcome back to the Data Pulse. We've been talking with Carlos Avalos, and we need to talk about some of his partners and how the information they gather through the SCBRFSS actually helps them.
Yeah. So, for example, I mentioned the Children's Trust of South Carolina. They are really interested in these non-medical factors called adverse childhood experiences. An adverse childhood experience is something that a child experiences that can negatively impact their health trajectories, basically. Something like parental divorce or drug use in the house, or substance or other types of substance use in the house, as well as physical and emotional violence and abuse, right? So they are really, the Children's Trust works really closely with raising awareness about these factors, and also trying to pinpoint where in the state more resources need to be provided to raise awareness in smaller communities, and maybe provide preventative information and resources. And every 4 or 5 years, we include those questions in the survey, asking South Carolina adults, about these experiences, and trying to understand what the prevalence of these experiences is in our state. So they utilize that information.
So before we let you go, let us know if there's a website that people can actually find this information.
Yes. So since this is public information, and something I want to add too is this is a random digit dial survey. So we don't ask for personal information. We're not going to ask for your name. We're not going to ask for your address. The lowest level information that we might ask is for county and zip code, so that we can make public health decisions at that level. South Carolina BRFSS data. We have several dashboards there as well that we've developed with some of our internal partners. and the data is publicly available on the CDC's website.
Carlos, thanks for joining us today. Great information. That wraps up this edition of the Data Pulse. Have a great day.